Hello, and welcome to this brief educational tutorial on the Gonstead system of chiropractic. My name is Dr. David Geary. I am in private practice as well as a board member for the Gonstead Clinical Studies Society. We welcome you on your journey towards selecting a qualified Gonstead chiropractor. As chiropractors within the Gonstead discipline, our focus is on restoring the integrity of the entire spine, upper and lower extremities as it relates both to peripheral and systemic health. We do so by correcting spinal subluxations. What's a subluxation? Well, everybody knows what a dislocation is. When two joint surfaces completely lose contact with each other, that's a dislocation. A subluxation is simply a partial dislocation, but that can have neurological disturbances within our body affecting pain and dysfunction. Dr. Gonstead was considered the greatest chiropractor that ever lived, not only by the sheer volume of patients that he served and their satisfied results, but importantly because of his tireless devotion to not only teaching and understanding the science behind structure and function, but his ability to teach chiropractors how to properly analyze the spine and importantly to make corrective adjustments. This was his legacy. When choosing a Gonstead chiropractor, there are important objective criteria that need to be included in order for successful care. Number one is an x-ray. Here's an example of a full spine weight-bearing x-ray that are obtained in our practice and in any qualified Gonstead chiropractic practice. And the importance of a weight-bearing x-ray is we want to observe structural, mechanical changes or postural changes in a weight-bearing environment so we can see how a joint looks when it's under gravity. So things that we look for when we're observing the spine: here's the pelvis, this is the spinal column. Is there a level foundation? In other words, is it unlevel or is it twisted a certain way? That can affect the leg length. Sometimes that's due to a pelvis that's actually malpositioned, or what we call subluxated. That can create a change in leg length. Sometimes it's actually due to a true anatomical short leg, or if somebody has a fallen arch, that can affect the actual length of that extremity. But that has bearing on our foundation, which ultimately has an effect on the rest of the spine. So not only are we ruling out medical concerns and pathologies, but we want to have a sound structural analysis with a weight-bearing x-ray. Instrumentation. It is understood that the internal environment within a joint is actually communicated to the outer skin periphery through nerves. So in other words, when there is a disturbance within a joint, neurological communication takes place from internally through the skin adjacent right to where that nerve is disturbed. With an instrument, we can identify that precise level. We have different types of instruments. This happens to be one of the older original Temposcopes. There's little thermocouple probes right here on these tips, and those are used when we glide down the spine. So it would be something like this. When we're gliding that scope down the spine, we're looking for temperature differentials at each particular level. It's important your chiropractor uses that on each and every visit. It enables him or her to actually stay focused on care and what your appropriate treatment plan and regimen entails. Next, palpation. All chiropractors palpate the spine. In order for us to palpate, we need to have skin contact. It's difficult to do that through clothing. So female patients, we have them in a gown. Male patients, of course, the shirt would be removed. To that end, we look for specific patterns of swelling, muscle tightness, or what we call hypertonicity, as it relates or associated with specific patterns of joint loss of movement. That joint loss of movement that we find on an examination should be consistent with what we see on an x-ray. But both the instrumentation and the palpation enable your chiropractor to determine what an appropriate schedule of care is and also monitor the progress. Hopefully you can appreciate that great care is taken to ensure both precise analysis, encompassing all these different objective criteria, and equally important is to ensure a mechanically specific and corrective, hopefully painless adjustment that not only enables short-term immediate pain relief, but importantly, long-term correctional structural changes as well as functional improvement. Finally, in closing, it is our sincere desire that we provide you the educational understanding of how to select a qualified Gonstead chiropractor so that you are able to locate one and pursue your health concerns and challenges within this wonderful discipline of chiropractic.